over prescription drug overdose prevention and how to administer naloxone. Also with us is Portia Ray, who's kind of helping us with polls and administering things as we go along. So we will jump right in, guys. The first thing I want to start with to kind of get us all on the same foot is a poll. So Portia's going to bring up our first poll that asks you, have you ever been prescribed an opioid for pain? They're very common. So just, you should see the poll popping up. Do you all see that poll? If you'll hit a quick yes or no in the chat so we know you're seeing that. Poll is not showing up.
Okay, I relaunched it, everyone. Are you able to see it? Cool, people are voting. Thanks, everyone.
Perfect. Okay, and we'll give everybody just a few more seconds to answer that. Okay, so you can see our results here. Have you ever been prescribed an opioid for pain? And 83% of you said yes, and 17%, which is in this case just one person, is no. So I mean, I think that just kind of helps be a reminder as we talk through this how common opioid prescriptions are. They're, you know, for post-surgery, for having wisdom teeth out, for breaking a bone, they're very common. And so a lot of us are going to interact with them or have friends or family that interact with them. So why is overdose prevention important? So drug overdose is now the leading cause of injury death in the United States. And prescription painkillers account for about 80% of those deaths. So like we just kind of talked about how common those prescriptions for opioids are, that's 80% of those overdoses are coming from prescription opioids. So it's coming from a doctor and then ends up being misused or overused. And we're going to pull up the second poll here and ask what used to be the leading cause of injury death in the US. What's your guess? And I'll note this is injury death, not all types of death, but specifically injury death. Okay, so you can see here we have 67% said car accidents, 33% said suicides, and the answer is car accidents. Used to be the leading cause of injury death, and if you think about how often, before coronavirus times at least, we were all in our cars, driving many places in a day, and so your risk, right, your potential for a car accident could be fairly high with just the exposure we all have being in cars all the time. And so now drug overdoses have passed that as a leading cause of injury death. So again, just kind of speaks to how large of a problem and impact this has had in our nation as well as in Oklahoma specifically. So we're going to kind of look at the wave of the epidemic in our country, kind of help everyone understand where we've come from and where we're at. So if you look here, this chart starts in the late 90s, and around this time is when there was a big push in the medical community to recognize pain as the next vital sign. We didn't want people to be in pain for whatever the reason. There was just no need for people to have to deal with pain, and opioids at the time were being praised as the medication to prescribe to help people with pain. And at the time, there was also a medical paper out that said there was a really low risk for addiction. And that was actually disproven. And we now know that opioids can be highly addictive, but that was what was circulating in the medical community. So unfortunately, there were multiple aspects causing that. Let's prescribe these opioids. This is the safest medication, and people shouldn't have to deal with pain. So when you look in the late 90s, that's where our commonly prescribed opioids, you see this dramatic increase happen as we go into the 2000s. And then midway through the 2000s, you can kind of see around 2010 where that increase sort of levels off a little bit. It dips down and levels off. And this is when we start seeing some prescribing guidelines come into play. As the country has seen this epidemic occur, they've added in guidelines trying to reduce the prescribing rates. And what happened in some cases is people were cut off of their opioids, or doctors stopped prescribing them without tapering them, without helping them transition from that medication. And so if they go through withdrawals, they might turn to illicit substances, and heroin is a semi-synthetic opioid. So you see this heroin spike pretty significantly as those commonly prescribed opioids are sort of leveling. And then this third wave is our synthetic opioids. And one that you've likely heard of before is fentanyl or tramadol. Both of these can be prescribed or illicitly procured. And so fentanyl can be used in, it tends to be more common in end-of-life care or really significant injury or pain situations, but could be used in chronic pain situations as well. And like we said, it can be highly addictive, and fentanyl can be upwards of 50 times stronger than heroin. So as that starts to come into the market more commonly, both again from prescriptions and illicit versions, as this epidemics continue, you see this huge spike in those synthetic opioids being used in our country and causing overdose deaths. Because someone may be used to a certain dosage and then try fentanyl illicitly or from a friend, and it's way too strong and they overdose from that. Does anybody have questions on kind of this, the three waves of the epidemic? Okay, we're gonna go ahead and move on. If you have just questions as we go, feel free to put those in the chat and we'll be watching for that. So this kind of just gives you another view. We were just looking at a chart of overdose deaths, but for those overdose deaths, there are a lot of other people that are impacted, not just those who die from an overdose, but others as well. So for every one prescription or illicit opioid overdose death in 2015, there were 18 people who had a substance use disorder involving heroin, 62 people who had a substance use disorder involving a prescription opioid, 377 who had misused their prescription opioid in the past year, and nearly 3,000 who had used a prescription opioid in the past year. So when you're just looking at that prescription rate and how easy it is to access an opioid and how simply misuse can start to occur and lead to substance use disorders. And so for those one death, there's all these other people who are interacting with opioids and dealing with misuse and substance use disorders. And when we look at Oklahoma specifically, this is a chart of unintentional poisoning deaths, and we're looking over a 10-year period. And that top blue line is all poisonings. The lines that we're really going to look at here, the prescription drug line is this yellow line that you see. And you can see that, again, as those prescribing guidelines came into play in the mid to late 2000s, we see a drop in these prescription drug overdose deaths. But at the same time, we see this green line, which is illicit opioids, having an increase, as well as the methamphetamine line is going up. Now, I don't have a poll for this, but I'll let you guys answer in the chat if you have any thoughts. Why do you think, as we see prescription drug overdose deaths going down, but then we see methamphetamine deaths coming up? So I don't see any comments coming in, but if you're working on one, feel free to continue, and we'll watch for that. But what can happen when someone is dealing with a substance use disorder, and an opioid is a depressant, so it slows the body. Yeah, Regina, substituting one substance for another, they couldn't access this, so they sought out a different substance, and methamphetamine is easy to find and it can be fairly inexpensive. And so that definitely could be one reason. And also some people may start to try to self-regulate. So that opioid is a depressant and methamphetamine is a stimulant. And so as they continue to use that opioid, what it used to take to feel normal or happy is taking more and more, and that depressant is really causing issues, so they need something to bring them up. And so then they turn to another substance to regulate. And so then they're co-using opioids and methamphetamines together. So that's how some or polysubstance use can occur. Again, looking at our impact here in Oklahoma, opioids are the most common substance involved in a fatal overdose in Oklahoma. So this circle here on the left side is the type of poisoning, and you see 67% were prescription drugs. And of those prescription drugs, 64% were opioids. So nationally, it was 80% prescription opioids, and in Oklahoma, it's 64% of those deaths are from a prescription opioid. So again, that's kind of why we emphasize these are people who have received that likely from a doctor, and then either have misused or overused or gotten medications from a friend, things like that. So it's important to remember, that this is something that can impact anybody. Looking on a national scale, we've had some progress here in Oklahoma compared to the rest of the nation, which is good news. If you look at the chart on the left where we see overdose death rates for 2015, this dark blue, which is the color for Oklahoma, is statistically higher overdose death rate than the rest of the country. The green is statistically lower, and the light blue is statistically the same. So you can see in 2015, we were statistically higher than the rest of the nation. And then 2 years later, we're statistically lower than the rest of the nation. So we are seeing positive impacts come out of our prescribing guidelines and educating the community. And that's also part of why it's so important and great that you guys have joined us today and to continue sharing this message. So just a quick disclosure on our funding source. We are funded by the Oklahoma Department of Mental Health and Substance Abuse Services, and it's the state targeted response that allows us to present this information to you and helps pay for all of the free Naloxone kits that are available across the state. And we're going to talk a little bit more about that as we go through the presentation. But this just kind of lets you know where that funding is coming from. And the goal of this is to really reduce opioid overdose deaths and connect people to treatment. So Naloxone is available, and we're going to talk more about Naloxone here in a minute, but it is available across Oklahoma for free at local sites called hubs. And we're actually going to jump over really quick because I want to show you this little map. Makes it look like you can find it here, and there's an easier way to get to finding a Naloxone hub near you. So if you look over here, we have this visit okimready.org or text the 55155. If you text Naloxone to this 55155, it's going to send you to the OK I'm Ready website. So I'm just going to jump over and show you what that looks like really quick so that you can see how to search. Okay. Hopefully you guys are now seeing this screen that says opioid overdose on it. Was everybody seeing this website screen? Perfect, thank you for letting me know. When you go to the okimready.org, you want to go /overdose, which you can access here from the menu as well. That's the page we're already on. It'll let me go back. And there's information on here about what is Naloxone, how does it work. There's a nice reminder video of how to administer it. And then down here at the bottom, there's a map of the Naloxone hubs. So there's also a list if you just want to scroll through the name of the list, but if you want to put in a specific zip code and see, you know, if there's a site near you. Somebody have a zip code they want me to search. Okay. Oh, that's 74, sorry there, let me fix that. Okay, so that says no providers found. Regina, where are you at? OKC. Well, that's not correct. There are several in Oklahoma City.
Let's try 73120.
Ah, you're looking in Cushing. Okay. I will say the search feature on here is a little quirky, as we're currently experiencing. The search parameters on it can be a little bit weird, so we're just going to go back here. You can also zoom in on the map and look at areas, and you might have to try. So you can see here is Oklahoma City. You can see all of these little points. These are all Naloxone hubs. So Cushing, I don't know where Cushing is off the top of my head, but you could come in on this map and look for that specific area in the state and find a site there. There are sites across the state. Obviously, Oklahoma City and Tulsa probably have the most sites because we've got more larger population in those areas. But there are sites across the city, and you can look on here. Now, I will say with our current situation of social distancing, the hubs are still opening and they are still offering free naloxone kits, but they are asking that you call before you visit. So please give them a call before you go in and make sure that they are prepared to receive you. And they are working on almost like a drive-through situation, but they haven't quite gotten that completely figured out. There's a lot of logistics to that, but they are working on having people come in to get kits. So just make sure you call before you go to get your free kit, but it is an anonymous process. There is a short survey, but it's anonymous and very easy to access. So we'll jump back over to our PowerPoint over here. I just kind of wanted to let you guys see what that looked like. Okay. So what are opioids? There are kind of three classes of opioids. There's the natural form of an opioid, which comes from the opium or poppy plant. So opium, morphine, and codeine are the natural versions of opioids. We're all fairly familiar with the term of morphine in a medical setting. And so then we have our semi-synthetics, which take that natural base and use a lab-created combination to come up with our semi-synthetics. So these are some of our really commonly prescribed options here for pain relief. We see the hydrocodone, oxycodone, hydromorphone are really common after, again, procedures or breaking a bone, or you visit the ER for something. This is something you might leave with a prescription for. And then heroin is also a semi-synthetic, so that's an illicit form, but it's also a part natural, part lab created. Then we have our fully synthetic opioids, the fentanyl, methadone, Demerol, tramadol, and again, both the fentanyl and tramadol can be fairly common in certain prescription situations, and methadone is actually also used for treatment sometimes, but any of these opioids have a risk for addiction and a risk for overdose. And so why is there such a risk for overdose, and how does overdose happen in the body with an opioid? So we're going to look at that really quickly. So in your brain, there are these opioid receptors, which we'll see if, there we go. And So the body is already kind of prepared and ready to receive this medication. The receptors are part of where we have some of those positive endorphins are released. And so when the opioid comes in and sets on those receptors, it has kind of a direct connection. It sits very happily in that receptor and gives often a really positive or euphoric type of feeling. And it's going to be different for different people, how their body responds, what kind of feeling they have, but it may go beyond pain relief and move into, like I said, kind of an endorphin type feeling, a positive euphoric feeling. And so the brain says, hey, this works really great. I usually have to do these things to have this kind of feeling. But if I just take this medication, I get this feeling really quickly, and it's potentially a really bigger feeling than all these other activities. And so the body itself can become dependent or addicted very quickly because it says, hey, this is more efficient, right? This is more efficient to get the same result in the body. As well as then there's the mental aspect of receiving that feeling and becoming addicted to how that makes you feel. But what happens in the brain to cause overdose is, like we said, this is a depressant, and if the receptors become overloaded with opioids, it's calming the body, it's slowing the body, and it tells the body to calm and slow so much that it says stop breathing. It tells the body to quit breathing altogether. And that's really what's happening in an overdose, is someone has stopped breathing and the body starts to shut down. So you see a poll popping up here. It says, true or false, the body can build a dependence on opioids in as little as 7 days. Let's give everybody a second to respond to that. Okay, and you can see everybody answered true to this, and that is correct. So in as little as 7 days, your body can build a dependence to opioids. And so that could also mean that someone was prescribed an opioid for a legitimate reason. They're taking that opioid, they take that for 7 days, and then they try to stop taking that opioid, and their body's already built a dependence. So it craves and couldn't even withdraw from that opioid, and so they could go into pain and think, oh, I still have pain, so I need more of that medicine, and really it's the body responding to not having that opioid. And so as we've learned this, and the medical community has learned that that's part of where our prescribing guidelines come to now, they will usually only give a maximum of 7 days for a acute injury or surgery because of this data. So going into how to prevent opioid overdose, we're going to talk about these 3 things: who might be at risk, how to recognize an overdose, and how to administer naloxone. So who is at risk for opioid overdose? So we are going to switch over to a kind of a drawing board here, and I want to have a few comments from you guys on, you see some options here, but who might be at risk for an opioid overdose? And put that in your comments. Okay, I don't see any comments coming in, so we'll kind of talk about this a little bit. What we like to say is that really anybody who is using an opioid for painkillers is at risk for an overdose, especially if they're on high doses for chronic pain. Our body starts to build tolerance. And as we build tolerance, we might have only taken 1 pill before to get the pain relief that someone needed. They now think, well, I'm just going to take 1 more. I'm not getting the same pain relief, so I'm going to just take 1 more. And if their body is not ready for that additional pill, then they could overdose from just taking one too many. But also as they use more and more, it's going to take more to receive the same pain management. And so the dose is going to go higher and higher, and sometimes that goes higher and higher until it's too high. It's too much for the body to manage, and it overdoses. It slows and stops breathing. People using heroin, and we point that out because you may know someone that you work with, family, friends, that does use heroin, and so it's important to know that they're at risk for overdose because they may have a tolerance and they may be used to using, but when they are getting something illegally, they might get access to something that's much stronger than they're used to. It might be laced with fentanyl or something much stronger, or carfentanil, and cause an overdose. So it's just important to know that that person in your life could be at a greater risk for overdose. And then someone who is coming out of treatment for a substance use disorder. So again, kind of comes back to that tolerance. If they have built a tolerance and then they go into treatment and they detox and they're no longer using, or maybe they're using a medically assisted treatment that's much lower dose, and then they relapse, which can be a common part of the treatment process, and they choose to use again what they used to be able to use and have no problem, could now cause an overdose because they've lost that tolerance. Their body's gone through some detoxing. So it's just, again, important to know that that person in your life could be at risk, and you want to be there to help them. And then someone, again, coming out of incarceration who maybe while incarceration didn't use, they come out and want to use again, and they use what they used to use before they were in prison. And now, again, that tolerance is gone, and that amount could cause an overdose. So some important things. Also something important to note in this situation, if someone is dealing with addiction, or they're not sure if they're dealing with addiction, they're having trouble quitting that drug, why do we think, or how do we think stigma might play a role in being a barrier for them? And again, throw any comments or thoughts that you might have in the chat here on how stigma might have an impact. Anybody? I can't see the chat box anymore, but I don't think we've got any chat items coming in right now. And stigma is that sort of, there we go, there's one. So Regina says they're embarrassed and do not want to ask for help. Absolutely. That our society reacts to addiction in a way that makes people feel embarrassed or feel shame. And so it's important that, again, having these types of conversations helps people understand that addiction, it can happen. It can happen to anybody, and it's important for people to say, I need help. And so the more we can try to break down that stigma as a society, that it's okay to ask for help, and we'd rather somebody ask for help if they're dealing with addiction than try to deal with it on their own, and face potential overdose or the consequences that can come from addiction. So it's important to ask for help, and help is available. I also see that she says often they don't tell their doctors they have an issue with addiction, and so they end up getting more prescription opioids than they should, when they shouldn't be getting them. Definitely, that can happen, especially if they're continuing to complain of pain. But I still have pain, and they're not telling that doctor. Thankfully, doctors are becoming more aware of how to talk with people and try to assess if there's addiction, but that is not going to be every situation and every physician. And so it's important for patients to feel comfortable and not feel like they're going to be judged if they say, I am struggling and I need help.
I would also like to add, in some cultures or ethnic groups, it kind of ties with number 4, the shame part. In some communities, that's just something you don't talk about. It's just, you internalize it and you deal with it by yourself. So I put cultural stigma as well.
Yeah, absolutely. Thank you for adding that point. Okay, so we are gonna switch back over to the PowerPoint here. and go into signs of overdose. So when someone is overdosing, like we said, the body has slowed and has stopped breathing. That's what's happening. The opioids have overloaded the receptors and the body's stopping. So when someone is not breathing, their lips and nails are going to be blue. They're likely to not be moving. They can't be woken up. Their skin feels cold and clammy. Their pupils are really, really tiny. You may notice some very, very shallow breathing if someone's in the middle of overdosing, but shallow to no breaths. The person might be choking or gasping for air, and that can come from, again, stopping the breathing, and sometimes when someone is overdosing, they may vomit or aspirate, and so that fluid sits in the throat, and if they're not breathing, they can't clear the fluid. And so it's stuck in the throat, and that is where the choking or that gurgling could come from. If they're not breathing at all, but you hear a gurgling or almost snoring sound, it could be fluid or vomit that's stuck in the throat from the overdose. So important signs to look for in an opioid overdose. And I have heard from first responders that the tiny, tiny pupils is a really big sign that it's an opioid overdose and not another type of overdose, that they are like pinpoint tiny, tiny when it's opioids. So moving into what is naloxone. If we're going to help someone in an overdose situation, naloxone is an opioid overdose reversal drug. So naloxone only works in a situation where someone is overdosing from an opioid. So it will not work if they're overdosing from another substance. However, I always say, if you're not sure, you don't know what substance is causing it, use naloxone, because it could be an opioid and this would save their life. If it's not going to make a difference. But if it is an opioid, you could save their life. Or it could be a multi-substance situation, and this may help at least wake them up if opioids are part of the situation. Naloxone does not cause harm, and you cannot cause an overdose from naloxone. So it's extremely safe, it's extremely effective. You don't have to worry that someone is going to abuse naloxone, that you're going to harm them anymore. If anything, you might be saving their life, so you're not going to hurt someone by giving them naloxone. And how naloxone works in the brain is it actually knocks those opioids off the receptors, and we're going to look at a graphic here in a second that kind of demonstrates that for you. But again, it's only going to block those opioid receptors. So no opioids, there's no effect, but it's not harmful. If I'm not on an opioid and I use naloxone right now, nothing's going to happen to me. Nothing, because there's no opioids to remove from my opioid receptors. So it's not going to cause any change to me. It does temporarily remove the high. So if someone is overdosing or was very high as this was happening, it could be painful because, again, those opioid receptors the opioids are being completely knocked off. So it could be a bit painful for them to come out of overdose. So just being aware of that, but it's going to give their body a chance to breathe and to wake up. And it works very, very quickly within 1 to 3 minutes and lasts 3 to 90 minutes. And that's important to note because someone can re-overdose. So as we go through the steps, that's an important thing we point out, that re-overdose can happen, and so medical attention needs to occur. Even if they wake up and they seem fine, the opioids could come back and overload the receptors again. And naloxone cannot be abused, and you cannot overdose using naloxone. So here's kind of our graphic. We have those same receptors that we had earlier with opioids overloading those receptors. And then we introduce the naloxone as a nasal spray, and it comes in and just knocks those opioids off the receptors. So they're still in the body, they're still in the brain, but the naloxone has knocked them off and sits in their place, allowing the body to wake up, to take a breath, and to remove the effects of the opioid on the body. So real quick, look at your polls. I've got a question here. Naloxone can neither be abused nor cause overdose, true or false? So I give you guys a second to enter your answers. Okay, we're gonna give that about 5 more seconds. All right, so the majority, the 100% of people who answered our question said true. It cannot be abused nor cause overdose, and that is correct. So having naloxone in your home or giving it to someone with a substance use disorder, it cannot be abused and they cannot overdose on it. The only thing that it can do is save someone from an opioid overdose. So there's really no reason to not have this medication in your home or to give it to someone you know deals with an opioid use disorder or has a prescription for an opioid. So we're going to go through the steps of administering naloxone. And we're going to go through these one by one. This is kind of your overview screen. So we're going to go ahead and move into the first step of responding, which is to stimulate. So you come on someone that is potentially lying on the ground and not moving. The first thing we're going to do is try to stimulate, try to see if they respond. Because perhaps they're not overdosing, they might be high, or maybe they are drunk or under the influence of something, but that doesn't mean they're overdosing. So we want to try to make that distinction if possible. So we might try the normal methods of talking to them, shaking them a little, touching them, saying, you know, hello, wake up. If that's not working, we want to move to a second step of stimulation. And I make that point on purpose because this next step could be, would be fairly painful for someone if they're not overdosing. So we want to try our normal methods of trying to get them to respond before we move to what we call the sternal rub. So for the sternal rub, if you see in the picture, the sternum is kind of that bone in the bone right on the chest. You're going to take your fist, and I know I can't see you, but I'm just going to assume you're all doing this with me. If you look, you're going to make your hand into a fist like this, and you're going to make that index finger, sorry, Zoom's doing weird things, into a hook. So a little hook like that. And you're going to take that fist with that little index finger hook and take that hook and just press on your sternum a little bit and rub, just a little bit of pressure, and you can feel pretty quickly how deeply you feel that. And so if someone is not overdosing and you do a sternal rub, they're going to respond to you quickly. And if you think someone is overdosing, you think they're dying, you're going to put a lot of pressure. You're going to rub hard because you want to know, are they okay or are they not? And so if they're okay, they're going to respond very quickly and you're going to know it. If they're not, and they're not stimulated by that sternal rub, then we know we're dealing with something very significant and we need to respond quickly. So after we've tried to stimulate, the sternal rub has not caused any response, the first thing we want to do is call 911. Can anybody tell me quickly in the chat, why do we need to go ahead and call 911 right away?
Okay, we have a few comments. Regina stated that naloxone only takes about 15 minutes. It takes a while for people to wake up. This might be another medical event.
Absolutely, all of those are appropriate reasons. The naloxone, and it depends on what's in their body, how long the naloxone might last. So they, like we said, they can re-overdose. They still need treatment even once they do wake up. If they've gone through an overdose, they need additional medical treatment, and this could be something else. We're treating for an opioid overdose, and this is not an opioid overdose. It's something completely different. And so we want 911 on the way while we are trying to respond and help this person. We want EMS to be en route for whatever may come next. So our next step, we simulated with our sternal rub. We have called 911, they're on the way. The next thing we're gonna do is administer the naloxone. So in this situation, a naloxone applicator, if you will, looks like this little nasal sprayer here. A kit comes with 2 doses, and they're in little foil sealed containers, so you know that it is sanitary and unused when it's in that foil package. We're going to peel back the foil, place the spray applicator in their nose, and press down. And if you've ever done an allergy spray or a saline rinse or something like that, this is a really similar styled applicator where you put your fingers on either side of this nasal portion and you just press down. And inside of one nasal spray is just one dose. So you're going to spray that into one nostril. It doesn't matter which one. You're going to spray that into a nostril and it's empty. It's done. That dose is over. The way that naloxone works, because a lot of people say, well, if they're not breathing, how does this work? How does it get into their system? And it's actually absorbed by the mucous membrane in your nose. And that's part of why it doesn't matter which nostril, and we don't expect that they're breathing in this situation, and it's absorbed very quickly by the mucous membranes. So we give the naloxone, and now while we are waiting those 3 minutes for naloxone to work, we are going to administer CPR. Now, in this situation, the important thing is to give chest compressions. If you feel comfortable to give rescue breaths and you have a way to protect yourself with the filters that they have or the breathing masks that you can use, if you have one of those and you feel comfortable to do rescue breaths, then you would give rescue breaths. However, if that's not appropriate or you don't feel comfortable or you cannot protect yourself, then you're just going to do chest compressions. Why would we do CPR in an overdose? Not much in the chat. I don't see anything coming in just yet. The reason we want to do CPR in an overdose, we're trying to restart the body, right? The body stopped breathing, which means then our heart's going to stop, our whole body is shutting down, and so we want to jumpstart the body. We're trying to let that naloxone work, but we want to keep the heart going if we can, and get that body jump-started and waking back up. So that's why we're going to give chest compressions. And again, if you're comfortable and safely can give rescue breaths, then do. If not, then just continue those chest compressions. As a brief note here, while you're doing this and waiting for that naloxone to work, that you want to be on the upper half of someone's body, which we saw in our previous graphic right here, and that you want to be clear of someone's legs. If they do come out of an overdose, the body's physical response may be to kick or jolt, and so you want to make sure that you are clear of anybody's legs in this situation, just as a quick safety note in this circumstance. So after 3 to 5 minutes, I like to say more like 3. If you get to minute 3 and they're not responding at all, and you've given the naloxone and you've done the chest compressions, let's go ahead and give the second dose. Again, doesn't matter which nostril, but you need to open the second dose of naloxone. The first one you've already given is out, it's done, move on to the next dose. And so we want to spray the second dose of naloxone and continue CPR. The reason it could take more than one dose, it depends on what opioid is in their body. And so especially if they had something strong like fentanyl in their body, it may take more than these 2 doses as well. And that's again why we wanted to have 911 on the way, because these efforts may not wake them up, and we want to know help is still on the way while we're trying to save this person. If the naloxone does work and they do wake up, we want to place this person in the recovery position once breathing is restored. The recovery position is all about allowing free airflow and helping the person breathe. It is important when we're doing recovery position to do this with kind of as carefully and slowly as possible. If you will, someone may have fallen when they overdose. They could have hit their head or their back. There could be other injuries, we don't know. And your job is not to try to have to figure that out. If you're not a first responder, you're just trying to help them breathe, restore breaths. And so you're just going to roll them onto their side with your hands supporting their head. And then you want, the reason you see her 2 arms here, she has one arm laying and then the other arm is on top, is to give the head a fairly stable place to lay and the airway to be clear. And if they did have any fluids or vomit before, while they were overdosing or coming out of overdose, it can happen at either time, that helps that airway to be clear, and they can clear any fluids or anything from the airway and breathe normally. And then if you'll look at the knee crossed over, it keeps the body from rolling. And then if you look here, we have a quick memory question on the process. What is our first step after we've tried to stimulate and use the sternal rub to determine if it's an overdose? What's the first thing we want to do after we think this is an overdose? We'll give you guys just a few more seconds to answer. Okay, so we've got 67% that said call 911 and 33% that said administer naloxone. So, and anytime I ask this question, we always get mixed results, and it's part of why we review it. It is super important. You've tried to stimulate, they're not responding. You think this is an overdose, we want to call 911. Like we mentioned, perhaps the naloxone doesn't work, or this isn't an opioid overdose, it's a different kind of overdose, or it's a heart attack, it's a stroke, something else is happening and we've approached the situation and naloxone isn't going to do anything. We want EMS to be on the way to come and help this person, and even if it is an opioid overdose, they still need medical treatment and assistance. So super important. You think this is an overdose, they're not waking up, the sternal rub didn't do anything, call 911 and then move to your administering naloxone process. So here's kind of your review screen of the process. We're going to stimulate. First, you want to try to normal methods, talking to them, shaking them some, trying to get some response. Move to that sternal rub if that's not working. If no response from a sternal rub, then we want to call 911. And then we move to giving the naloxone, doing CPR, and then repeating. If they don't come to wake up after about 3 minutes, then we want to administer the second dose and continue CPR, and then move them into recovery position if they begin breathing again. Does anybody have any questions about this process of responding? Okay. If you have any questions, feel free to put them in the chat and we will address them when they pop up. So just a quick note for you guys, here in Oklahoma, you are protected under the Good Samaritan law if you administer naloxone to someone. So you can go into that situation knowing that you are attempting to provide life-saving measures, and so you are protected by Oklahoma laws in that situation as a Good Samaritan. So the full bill information is up here if you ever wanted to go read it and know more detail for yourself, but you are protected as a Good Samaritan under this Oklahoma statute. What you can do as a patient is always advocate for yourself. So if you go to the doctor for something related to pain or surgery or injury and they offer to prescribe an opioid, ask, what are my other options? Are there other things I can do for pain management that are non-opioid related, just to help mitigate your own risk? If you are going to be on an opioid, if it is necessary and there is a medical application for opioids, for sure, if that is going to happen, then make sure you tell your doctor about all of your medications that you're on, because there are many different interactions that can occur. So even if it's a supplement you take, make sure you're clear with your physician and you let them know about any personal history that you may have with addiction to other substances, because once the body has gone through addiction, it does change the brain and we can be more susceptible to highly addictive substances, and opioids are highly addictive. So again, being clear with your physician about history and medications that you might be on. And if you're advocating for someone you take care of, your child, your parent, grandparent that you may be helping advocate for them as well. Hey doc, what else can we look at? Do we have to use an opioid medication for this situation? Some quick tips on safe use of prescription medications. It sounds super simple and people kind of laugh, but this really is this easy. If your name's not on the prescription, don't take it. And if their name's not on the prescription, don't give it to them. Like we talked about in being clear with your doctor about other medications, other symptoms, past history of addiction, you don't know all of those things about this person. And so it can be really easy to say, oh, hey, I have some of this pain medicine and you're in pain and let me help you and here, take some of my medicine. And that can really be very dangerous. And so it's important to never share those prescription medications, and likewise not take a medication offered to you in that regard. You never want to take more than prescribed. So the bottle may say take 1 every 6 hours as needed. And so you don't want to say, well, I'm just going to take 2 because my pain's a little higher today. That too could be an overdose for you. And it might not be for the next person. Everybody's body is different. And so it's just important to not take more than is prescribed and to reach out to your doctor if you're having additional issues before making any changes to your dosage. You never want to mix alcohol with opioids. Opioids are depressants. Alcohol is a depressant. And how that overdose happens is the opioids tell the body to stop breathing, to slow so much. So you add another depressant on top of that, and that could be a recipe for overdose. Likewise, there are many medications, anti-anxiety medications and sleep aids that can be really dangerous combinations with opioids. So again, being clear with a physician about everything you're taking so they can make the best assessment to assist you in that situation. So before we move into safe storage, we're going to pull up a quick poll and see what you learned from safe use. So to safely use your medication means, and there are multiple choices, so I'm going to give you guys just a second to answer that, and then we'll review it. Okay, so I've got 80% say all of the above, and our options were keep prescription medications in a secure location, taking prescription medication only prescribed to you and in the right dose, and never sharing your medicine with someone with similar symptoms. And the answer is all of the above. So yes, taking prescription medication only prescribed to you in the right dose is safe use. All of the above are items that are important to safe use. So thank you guys. Okay, moving into safe storage, which again, fairly simple, but you want to keep your prescription drugs, especially something like an opioid or any other prescription that could potentially be misused, locked in a secure location. And that's really to keep that out of the hands of anyone else in your home. If it's not prescribed to them, then they should not be taking it or accessing it. So you want to know where your prescription medications are at all times. If you have something like an opioid that's highly addictive, you should know how many pills you have. So if you were prescribed 7 pills, 1 for each day, and you all of a sudden only have 5 and you didn't take any, you know someone in your home has accessed those, and you can respond and find out what's going on and talk with that person and address the situation. So keeping track of them is an important thing, and keeping them in the original bottle. So moving them to like that daily pill counter, the Monday, Tuesday, Wednesday, thing can result in forgetting what pill you're looking at, and again, overtaking something completely by accident. So important to keep it in its original bottle. So we have a quick safe storage question for you as well. And so why is it important to safely store your medications? And we'll give you guys just a few seconds to answer that one. Okay, I think we're going to go ahead and end that poll. So the options were to prevent easy access, to protect your household guests from misusing medication, and you always know where your medications are at. And the answer, yes, 100% of you said all of the above, and that is correct. Because especially when we look at data on youth who have misused a prescription opioid, over 50% of them said they got it from a family or friend. It was easy access. It was right there. And so whether it's your own teen or someone else that might be visiting your home, keeping that out of people's access is super important to preventing misuse. So jumping into safe disposal, really quick, we were going to take you back to the OK, I'm Ready site, but for time, we will not jump over and look at that. But if you go to the okimready.org/prevention, at that site, there are several links where you can search for a local disposal site. So there are both pharmacies that have drop-off boxes inside of them. And so you can look up and find a pharmacy near you that has a drop box location. So if you're already going out, especially in our times of social distancing where we are being careful and when we go out, if you're already going to visit the pharmacy to pick up a medication or other things that you might get from the pharmacy, you could check and see if they have a disposal box first and take any medications you need to get cleaned out of your home with you and make that a dual purposed visit to the pharmacy. So that's an option. There are also police stations across the state that have disposal sites, and there's a separate link where you can look up police stations. Now those are open 24/7, so you could go at any time and dispose of your medications. And again, the purpose there is to safely dispose. Nothing strange is going to happen to you because you walk into the police department, even though it might feel a little bit weird or different for some of us. So those are lots of good options. If you aren't going to get out and you would prefer to try to find a way to dispose in your home, you want to avoid flushing prescriptions down the toilet. They have found that this is not safe for our environment. It can get into the water supply, which then affects fish, which then affects animals that eat the fish, can affect the groundwater, and can affect what we eat. And so it's really important that we don't flush prescriptions down the toilet. So if you are going to dispose at home, some options would be to take that medication, find something undesirable, the gross leftovers in the back of the fridge, kitty litter, coffee grounds, and pour that into a bag, like get a Ziploc, pour that gross thing into a bag, pour the pills in there, seal that bag and squish it up so you can't really, they're not recognizable and they're mixed with something that someone's not likely to dig through or get into. And then that prescription bottle, you want to make sure you either rip off that label or you've marked through with a Sharpie, blacked through that information so no one could take that and try to fraudulently fill the medication. So that would be a safe way to dispose of that in the trash and get that out of your home. And then there are also several pharmacies that are offering in-home disposal bags. And so you can also ask the pharmacist about receiving one of those, and that is an environmentally friendly bag that you can put your medications in. So those are some safe disposal options. And we're gonna ask you a quick safe disposal question really quick on the poll. And this one is multiple choice. So safe disposal is, I'm gonna give you a minute. This one is actually, you could select multiple options. And so, and I see some of you did that here. Take them to a Dropbox location at a local pharmacy or police station is a great safe disposal option. And also disposing at home by mixing them with something gross or undesirable and destroying the original label. All of that, those are both great options for safe disposal. So thank you guys. As just a quick reminder as we're wrapping up here, treatment is available. If you or someone you know or love is dealing with a substance use disorder or an opioid use disorder specifically, there is treatment. Medically assisted treatment is the best option out there where they mix using a medication to help because the body is addictive and needs to taper down or come down from that dependency, and then also need the counseling and behavioral therapy to deal with the mental aspects of addiction. But treatment is available, and we encourage you to access that or advocate for someone in your life who may need help accessing treatment. It's a great resource if you have questions about treatment options in your area, are to call 211. It's a statewide, it's actually nationwide, but it's a statewide resource. It's available 24/7. And they can look up all of the free naloxone hubs for you as well. So if you're on that OK, I'm Ready site and having trouble, they can help you find a site near you. They can find treatment facilities, and they're also going to look it up for your specific circumstances. So payment situations, age, different treatment centers have different restrictions and requirements, and they can help you kind of sort through that situation, as well as lots of other great resources. This is a great resource to have and know is out there to help you. Here's some other websites. If you want to learn more, you can look at SAMHSA. The OK, I'm Ready site is a really great resource. We do have a really short follow-up survey, which Portia has put in the comments. If you wouldn't mind, while this is all fresh on your mind, jumping over to that SurveyMonkey link and filling that out and giving us your feedback. We want to make sure that you learned great information, and we also want to know how we did. So we would really appreciate you taking the time to give us some feedback on there. And if you have any additional questions, this is my contact information. Feel free to shoot me an email or give me a call. And we are over time, but if we have any questions before we jump off, we can wait about 1 minute to let anybody throw in additional questions. Okay, well, I don't see any questions coming in, but if anybody thinks of something later, feel free to reach out to me again in email or phone. I appreciate you all taking time to learn more about opioid overdose and how to administer naloxone. Oh, and we have one final poll question, which really is, can you make a difference? And the answer is, yes, you can. By knowing how to use naloxone and having it, you could save a life. So we encourage you to get a kit and be prepared. So again, thank you guys, and have a great weekend.